Hello, everyone. Good afternoon, and welcome to our autumn webinar with Andrew Ward once again. This time, Andrew will be presenting two very short cases, which he treated with classical homeopathy. One is a case of chronic interstitial cystitis, and the other is a short case of glandular fever. I hope you will enjoy this webinar, as always, which is always very interesting with Andrew. And I just also wanted to add that this session is being recorded. So Andrew, welcome back, our autumn webinar, finally. So I give the floor to you.
Okay, thank you, Elena. You can hear me okay? Yes. Okay, welcome everyone to this autumn season. I'm going to present a couple of cases. They're fairly short, and once again, no picture, it says here. No picture of what? Can everyone see me? Yes. Yes, thanks very much to Talkers Compass for hosting these seminars, and we'll get started. So I think let me share my screen and start off with the first case. We are okay. Okay. So this is a case from actually from 2022. And this lady, 49-year-old, she came to see me with a diagnosis of chronic interstitial cystitis. Now, she'd had cystitis, urinary tract infection problems since she was 7 years old as a child. This is a very long-term problem for her. Not uncommon, but more unusual in children. And had a problem ever since. And now she's 49. She's developed this chronic conditions. So not the acute. Of course, we like things to be acute because they come and go. They have short duration and then they're finished. Once we start to go into chronic conditions, we see that the condition just stays there permanently. So like a subacute and then chronic conditions. So now, after all these years, of course, in the last years, multiple antibiotics have been given for the acute inflammation. And of course, the outcome of that is usually to develop a chronic condition as the whole inflammatory process gets suppressed. And then the immune system can no longer deal with it at that level, and so it becomes a permanent situation. So in the last year, we see multiple urinary tract infections, antibiotics, constant pain now, so not gaps of a few months, but now it's constant pain, burning, hot and sore, both during urination and when not urinating. So this is a very disturbing condition, and has had to resort now to using a catheter with saline solutions, so a tube, in order to urinate. So then there's inflammation of the urethra as well, and then has to take antibiotics if things get too bad. So inflammation of the urethra and bladder with frequent urging and burning pain. In the past, she had a history of tonsillitis as a child, again with antibiotics, and high fever. Now, this stopped in her early 20s, so went away, and then she stopped having these acute inflammatory tonsillitis. So we always need to ask about this fever history to see this pattern, and we see that there's been no high temperature in the last 10 years. So since her 30s, no acute inflammatory conditions, no fevers. So this is the tipping point at which the condition went down into the chronic zone and became a permanent condition. So this is the usual story: acute problems being suppressed over the years, and then they drop into a lower level of health and have to deal with a permanent condition. So this is her presenting condition. She is somebody that describes herself. She was very talkative, excitable. She said naive, and can get very shaky if she gets angry, trembling. Fears, fairly strong fear of spiders and horror movies. Food desires were quite strong. Salt and ice cream was very strong. Daily ice cream. So again, we have to be very careful with general symptoms to make sure that they're real. I would ask probably who doesn't like ice cream. Maybe there's one or two here who don't like it. Maybe 10, but maybe 10 out of 100 don't like it and 90 like it. So liking ice cream is not a symptom, but if it becomes something excessive, then you can start to use it as a characteristic symptom, and daily is, in my book, very characteristic. So, and an aversion to eggs. Thirsty, 3 liters a day. It's quite a lot of water, and she likes it to be fizzy water. Very heavy periods, always been heavy. And that was really the case that I took. Now, of course, in a case like this, you can try and focus on the local symptoms. But in my experience, it's much better to try and get a totality of the case, or an essence of the case, so we see a very clear picture of a certain remedy or combination of those strategies. And here we have quite a nice spread of symptoms across the different rubrics. We have some keynotes, and we have quite a good totality. So symptoms I put in here are trembling with anger, fear of spiders. This is the rubric for the horror stories. She can't watch these things. Horrible, sad stories affect her profoundly. And naive is an interesting rubric. She described herself as naive. So naive meaning believing everything that people say. And here we actually have a rubric in Compass of chronic cystitis. Not very many remedies in there, but still we can put it in. Paralysis of the bladder, so now she has to use a catheter in order to urinate. So things have taken a turn for the worse. and she needs to use this. And here we've got the inflammation. Oh, where's the... Here we go. Yes, so we've got the inflammation of the urethra. We've got burning pain, burning urine. She described it as burning, heavy periods. And then her desire for fizzy, carbonated drinks was very strong. Aversion to eggs was clear. Desire for ice cream was strong. It could be even stronger underlining there, actually, and salt. And that was another symptom, actually, that she mentioned as a general symptom. I asked her in generals what kind of things she feels better or worse. And she said, oh, without doubt, sleep is my medicine. She said, if I can sleep, I feel better. So very much better after sleep. Again, we can say who doesn't feel better after sleep? Quite a lot of people don't, actually. They can feel worse or the same. But for the remedy we're thinking of, sleep really does act as a medicine for them. Even a short amount of sleep, and they'll start to feel much better. So here we have the nice repetrization. Ask for the result. Of course, most of us would have known this was a phosphorus case. A nice essence, really, very, very sociable, talkative, friendly, naive, excitable person, affected by things very easily. And then the great thirst for carbonated drinks is a thing that we see in phosphorus. There's a few remedies, not many. And we see phosphoric acid has it, which we'll talk about later with the next case. Nature and colchicum also has it. So, of course, typically phosphorus likes lots of cold water, lots of cold, fizzy water. And we see aversion to eggs also. So we see here, we can have a look at, so a phosphorus, you see the totality, it's 13 out of 15 symptoms. This is really a full totality of the case. And we see this symptom of phosphorus in 4th degree. And they can tell you what things it's not in. Again, this rubric should be, it's not so useful because it's really more of a diagnostic rubric, but should have many, actually could have many remedies in, and inflammation. So it's much more important to have the mental symptoms and the generals in our case than focusing on the little local symptoms, which mainly you'll find in these cases are common to the condition. So burning when urinating, this is typical in urinary tract infections. So we don't see the characteristics in the local symptoms. Unless you have a symptom like, sometimes you get a symptom like pain when not urinating. So it's a slightly more unusual symptom, for instance. And really, this is we have some metadata here, which is this extra information that Compass gives us. A little bit of comparative material medicus. Here it's just saying, doing a differential with laccaninum, both liking salt. But laccaninum likes hot peppers, whereas phosphorus doesn't. And some more things here. All this information comes from various lectures of George Vitulkas and Basilis Gagas and various authors like that. And we see that it says that they have many fears, but express them in different. Phosphorus is much more open, and the fears they are experienced in a greater degree. They'll express their fears strongly, whereas calc will be more reserved in expressing their fears. So it's a little differential because they share a lot of the same fears, calcarea and phosphorus. So you see calcarea coming up here, 8 symptoms. So this is really a clear phosphorus case. So what was given on the 15th of July was phosphorus 200C. And then the follow-up actually was not until the 1st of January. So we're looking at July, August, September, no, 5 months later. And after the pill, she said she felt very wild for a few days. Just wild. She wanted it, she couldn't control herself, which was unusual for her. And then she tested a COVID acute, whatever that means, and with a fever of 39 degrees. So you see, almost immediately, we've got such a clear case, even though she's in a fairly low group because of no fever for a long time. The ability of her level of health to improve very quickly was there. And this is indicated by the clarity of the remedy. This is one of the clues. If the remedy is so clear, this means the patient has a very good prognosis. And you see here that after some days, she immediately develops a fever of 39 degrees after 10 years of no fever. So this acute lasted for 3 weeks. Now this, if you know this theory and information, you'll know that this kind of acute, which was severe, lasting for so long, belongs to a lower group. So in the higher upper groups, the acutes are very short and less severe. So in order to motivate her system to change level, there has to be a strong reaction, you see, and change of level, and we see a big acute. This lasted for 3 weeks in total. And then she started to feel much better in herself, much calmer. And she says, I feel the best I've felt since I was 16 years old. So this is a remarkable change in such a short time. And the cystitis symptoms have gone, disappeared, no burning or frequency. And everything was normal. And then we did another follow-up on the 16th of March, and everything was fine. Nothing came back, and we've got some more information here. In April, a mild UTI again with burning when urinating, with frequency of urging, stinging pain, wants to be warm. And we know from this thing, such a good reaction of a remedy. For that to happen so quickly after such a good result, there has to be some kind of interference. 200C would last much longer, or if not permanent cure. So I asked her about coffee, and she said she'd had 3 cups of coffee recently. So this is when the mild urinary tract infection came again. So she stopped coffee, and I told her, if you're no better, repeat the phosphorus in a few days. And within 2 days, the symptoms disappeared by themselves and no remedy needed. So this is what we call a temporary antidote from the coffee. So for those people who say coffee doesn't antidote remedies, it does, but not always. It depends on the remedy and it depends on the sensitivity of the patient. So personally, I'm not willing to risk such problems. So I tell all my patients to stop coffee, because I've seen it many times, this kind of interference, even months later. So she's stopped the coffee ever since. And we see, if you look in the old books on these things, you see that phosphorus is antidoted. I don't know if you know this book, very excellent book called, we'll put a thing up, Relationship of Remedies, Thomas Blasig and Peter Vint. And it gives all the relationship of the remedies from the classic authors. And you see under phosphorus, it says, antidoted by coffee. And that comes from Berningshausen, Herring, Clark, and Lipper. So these are authentic authors. Don't give phosphorus patients, they mustn't have coffee. Because they're very sensitive, as we know, oversensitive. And it will antidote them. So she was fine after that. And then she wrote me a nice testimonial. She said, I just had to write and let you know how absolutely life-changing my treatment from you has been. My health has never been better, thanks to you. I have suffered interstitial cystitis for 45 years. This began at 5 years old. I thought it was 7. At the age of 50, I'm finally free of this burden and now no longer need to manually catheter saline treatment into my bladder. I've now cancelled all hospital procedures and appointments and living life to the full. I'm so grateful to you for your expertise and experience, especially after having spent so many years with doctors and nurses in and out of hospitals and neurology clinics, all of which now has stopped, giving me more time to enjoy long walks with my dog. So nice to get this kind of effect and result. And I've certainly spoken to her since, and she's never had any problem since. And she sends lots of, she actually referred a patient to me recently because she's like, she does a mobile hairdressing clinic and goes to people's houses and she tells them to come and see me. So we need these people on our side. And she's good. So 45 years of cystitis, one remedy gone in a few months. This is the power of homeopathy if we do it properly. So here's the analysis, history of acute inflammatory illness as a child into the early 20s with tonsillitis and antibiotics. High fevers stopped over 10 years ago, dropped into level 7. Chronic condition developed from acute inflammations. Still, the inflammatory level is relatively superficial, i.e. the urethra and bladder. No pathology arrived yet, still functional. Also, as I said, the remedy appearing in a very clear way, suggesting a healthy organism that's initially dropped levels due to the suppressions. So she was probably in level 1, 2, and then dropped to 7. So after the remedy moves back to 1 very quickly with the fever in a few days. Immediate acute. So this doesn't happen always like this. Of course, in the lower levels, we don't always see such a clear picture. So that's when it becomes much more difficult, or the patient needs 3 or 4 remedies in succession in order to bring about that change. As I said, the 3-week acute also confirms level 7 or 8. Okay. So here I can show you, those of you who don't know Compass well, I showed you the metadata. We can see here. Here we have some options to filter out some remedies, but in large remedies, this like polycrests and small remedies, it just emphasizes a few remedies that taking away a lot of the information. So this sometimes can be useful. You see phosphoric acid comes up there, which has many similarities with phosphorus. Also we can see immediately the materia medica. So we hear uniquely with Compass, we have George Vitulka's materia medica, only place that's available. So, and we see here a nice picture of her, open, impressionable, naive, you see, sensitive, naive, easily trusting, fears, a lot of fears. And then heavy periods, thirst for cold drinks. So when you've got clear mental symptoms, clear generals, characteristic generals, you don't need to worry about the local symptoms. And ice cream, you see, and salt and cold drinks. Perfect. And here there's even a video with him explaining phosphorus, and then we've got Buraka, much more detail, of course. We don't even have anything particularly specific with the bladder phosphorus. Let's have a look at Clark in much more detail. Urinary organs. So you see here in the provings, we've got increased secretion, frequent and scanty. This is very typical of cystitis, isn't it? Frequent but small amounts, red, sandy urine, turbid, blood in the urine, smarting and burning when urinating, pain in the urethra when not urinating. So this was all her symptoms. We didn't put them in because we don't need to, with frequent desire to urinate. So even her local symptoms are here. So we can check all these things. We've got Kent, of course, the great Kent. Interesting here, after the phosphorus, she said she felt wild for a few days. Here we have in the proving wild thoughts. Maybe it was a proving symptom, which again tells us the remedy is correct when you get a little symptom of the remedy at the same time. And then we have an acute materia medica, which is nice. So in acute conditions, we see chilly with cold extremities, respiratory, worse lying on the left side, we know. So very useful. Okay.
Andrew, shall
Yeah.
I just give you a couple of questions that have
Yeah,
come up?
let's do the questions now. Yeah.
Okay, so Pam Muller says, how soon after the remedy did she develop the acute?
It was a few days. Just a few days. Yes.
Okay, and now there's another user, Amruta, and she asks, does decaf coffee affect similarly as regular coffee?
Not in my experience, no. It's better. if they must drink it, that's better. But still, there's caffeine in it, and it varies according to decaf. And I tend to just tell people stop it.
Okay. Well, basically, we don't have any more questions. The only question we do have, which I don't know who it is, it's anonymous. It says if you know if the patient received conventional medicines for her COVID and when she stopped taking antibiotics for cystitis.
Well, when I saw her, she'd still been taking antibiotics for the exacerbations of her cystitis. So in the previous year, she'd still been using antibiotics. And in code, no, the acute she didn't treat at all. I told her she has to. It's very important in an acute that comes like that. In this case, you don't treat it. She had to suffer for 3 weeks, but it was worth it because the cure was tremendous. Yeah, I see that question there.
Okay, so wait a minute. We have Marius Protopapas. The small relapse came after 9 months with 3 cups of coffee after the remedy. It's a question.
Yes.
Therefore, and how long do we expect a 200 ch dose to last without coffee?
Well, I would, as I say, she's being cured now. I would say it's permanent. But coffee almost, I don't know the length of period of time. I mean, I've even seen it after a year interfere. So I think it's best they stay off it for at least a year.
Stay off coffee for at least a year.
Yeah.
Okay.
I think in such a sensitive patient.
Okay. So, and I'll give you one more question so that you can go on to the other case, so we have time. How long do acutes generally last after the right remedy? This being COVID can be for lasting, but in your experience, do acutes last that long?
Well, that's all to do with the levels of health. I'm not sure if you're familiar with that. The levels of health explains all that. So it would be not a lot of time to do that here, but according to which level you're in, the acutes will come. The higher the level, then you'll see that the acutes are less often and less severe. And the lower you get, they get more severe and longer, and then they disappear altogether. So it all depends on what level you're at, really. So that's a little difficult question. But at this level, what we call 7 and 8, the acute, if it comes, it's usually long lasting, so 2 or 3 weeks. Yes.
Okay, so should we go on to the next case? Or
Yes,
do you want to
asking
give,
about the book.
do you want me to give the last question, which is from Penelope, and she asks, how long after the right remedy the acute will appear? And then I will give no more questions and you go directly to your next case.
Well, again, that depends on the level as well. In certain levels, you wouldn't expect an acute to appear, you see. But in lower levels, you want an acute to appear because they haven't got any. So the appearance of an acute is a good sign in that case. So you would hope for them to come soon, but sometimes they can take. Some cases it can take 6 months for the acute to appear. 6 months of treatment. Sometimes in this case it can come after a few days. In the upper levels, when they're already having acutes, you want them to have less acutes, not more. So it's all in the theory, really, which it's a bit difficult to explain that here, really, in this time. So if you really want to learn all this, then you can join my course. I'm running a 2-year course, 20-month course, which anybody can join at any point. We have recordings of all the sessions, so you can join in, catch up, and then start joining in live, and where all this information will be taught there. It's online, so you can contact me for details. Okay. So I need to just stop that share. And let me find the next case. Okay. Now, share again. Okay. So this case actually dates back from 2008. So this is pre-compass, but I put the symptoms on here anyway. And so you can see a long time ago. But I thought it was an interesting case, some interesting facts in here. This was a 23-year-old male. He came with his girlfriend. Now this is acute glandular fever, so this is during, not post glandular fever. It's during the glandular fever. So about 3 weeks he'd had this. He came with his girlfriend. He really didn't want to be there. He was very uninterested in the appointment. Just sat there. She made it. They were both overweight, what I call pear-shaped. So that's sort of like, and then so like this. For their age, excessively large. And he had a very I'm not bothered attitude. So the glandular fever had been diagnosed for about 3 weeks with blood tests. His symptoms were exhaustion, aching joints, fevers and chills alternating, and headache. Pains in the legs, glands swollen, cervical glands here, throat, and behind the ears. All these glands are swollen. Sore throat was left-sided. First sign was very dark urine with strong odor. The doctor had said, he said at his test that he was borderline diabetic, overweight with poor diet and too much sugar. I asked him about this and he said, oh yes, I love sugar. He said, I used to drink Coca-Cola or Dr. Pepper's. And he used to drink, as a student, 2 liters a day of this. 2 liters. This he's now stopped since the new year. So for 2 years, he's been drinking 2 liters of cola or Dr. Pepper's. So very, very big craving for fizzy drinks, sugary fizzy drinks, fruity fizzy drinks, also salt and sweets, of course. Emotionally, he was completely fed up, meaning just not interested, had enough, feeling very down. She says he just sits and plays computer games all day. No energy, can't work. He was off work. Worse from 6 p.m. onwards in the evening. In the December, he'd had a flu, which brought him down. And then things had started, like a post-viral. some history. He had eczema in his teens, then it went away and came back, and he used steroid creams, which cleared it up last summer. So here we have an interesting suppression of his eczema in the summer, and then he becomes ill in the December. So we see why that's important is that will be part of his issue, because he had an externalization, a skin eruption, which was suppressed. This is very important, and this would have brought his system down. And so what we know is, with the correct remedy, we expect that eczema to come back. That will be the only real proof that he's better. Even if he says he's better, we need it as proof. Very thirsty for water and fruit juice currently. Fruit, apples, pears, mangoes, and he likes mango smoothies. This is very typical of this remedy we're going to use here. This is what he wants to drink, mango smoothies. So we say, what do we expect to happen after the return of the eczema? So, remedy given was phosphoric acid. Let's see the result. Let's have a look at the symptoms first. So we see his mental state is apathy. It's a good description. We see that many remedies, but actually you see phosphoric acid is the only one in 4th degree. Tremendous apathy. Weakness during fever, swelling of glands, left-sided throat, urine dark color, and then the juicy things, refreshing. This is the rubric for refreshing things, the juices, and carbonated drinks again, which we saw last time. We remember we saw phosphorus, now we see phosphoric acid, and aggravation in the evening. So, and then we see the result. We see clearly phosphoric acid here. So 7 of the 8 symptoms. So again, very clear picture. We see phosphorus, of course, also 7 of the 8. The difference, phosphorus, we don't see such a strong desire for these juicy fruits and smoothies. And this is a strong thing of phosphoric acid. And we don't see so much of the difference, apathy. Album. So, yes, phosphoric acid 1M, single dose. 2 weeks later, they reported more energy by the next day. Remember, this is an acute, so you expect it to be quick, and swelling of the glands went down by the next day. In the 2nd week, the eczema came back. So this is great result. It's what we expect. Urine still dark, mood is much better. They said they know this because he's back to his old self, arguing with his sister. Eczema had started at 12 years old and got suppressed at 16. This kind of suppression of skin eruptions can lead to diabetes if there's a predisposition. So it's very important. We see this because he's heading towards diabetes. Still liking sweets and meat fat, hay fever in the summer, shaving rash, lazy, describes himself as lazy. So at this point we wait. We've got a good general improvement, so we don't do anything. 1 month later, follow up, energy back to normal, 1st full week back at work. Eczema came up on the right eyelid, on the back and shoulders, much better now. So it went by itself. Urine now lighter, eczema only on the eyelid. So in this situation, nothing to do, we wait. And then that was it. He was better within a month, totally free of it. Now, one of the things that interested me here was that to understand this, that, okay, he's in a phosphoric acid state, we would say that's the remedy. Now, in my understanding, that he was already in a phosphoric acid state when he was a student. How do we know? Because he was craving 2 liters of fizzy, sugary drinks a day. And it was already putting on weight and going into diabetic realms. So here we would say probably he already needed phosphoric acid. But as he didn't get the remedy then, the state developed and the organism eventually breaks down, contracts the flu, and then infective mononucleosis arrives. But he still needs phosphoric acid, of course. And I think he stayed in the picture, but it just became worse. And of course, we use phosphoric acid in treating type 2 diabetes. Very good remedies. So, and the other interesting thing here is if you look at any commercial fizzy drink, from cola to Dr. Pepper's to 7-Up, you'll see that one of the ingredients of all of them is phosphoric acid. It's in all fizzy drinks as a chemical. And it's because it's an acid, it's the thing that's responsible, or as kids will used to put a coin in a glass of cola and it would clean it. It would become shiny and new. It's because of the phosphoric acid. It's used commercially as a cleaning fluid. But they put it into these fizzy drinks. Now, why do they put it in there? It's a good question. It may have something to do with the fact that they know that phosphoric acid causes this craving for fizzy, refreshing drinks. They put it in there so people buy more. It's the only explanation I can think for why it's in there. Of course, it's a very strong acid, so best to be avoided. But it's interesting that as a student, he was craving these things, 2 liters of these drinks that contained phosphoric acid, his remedy that he needed. His organism was asking for the remedy, but of course not in that form. He needed it homeopathically. So sometimes the cravings of people or behavior tells us a lot about which remedy they need. So yeah, basically we had indifference, swollen glands, dark urine, sugar in the urine. His sugar was high. Carbonated drinks, juicy things, refreshing things. It's a clear picture of phosphoric acid, which we see here. Weakness, indifference, apathetic. You can see it on the acute level. Exhaustion, craving, juicy fruits, tonics, tonic water. So also it can come in from prolonged grief to bring people into this state. I believe his problem was due to drinking too much of these drinks, almost bringing on proving there's some kind of relationship with the phosphoric acid and bringing him into a diabetic state. Of course, afterwards he was fine, as far as I know. He was okay after that. Okay. Do you have any more questions now? Elena, are you there?
Sorry, Andrew, I was muted. Okay, so basically, we don't have any more questions for this specific case. We just have Ellen Friedman, who's asking if she could ask something regarding the first case, which is if the over-the-counter medications for cystitis, like azo, is permitted in the acute state to palliate the discomfort, if it's permitted.
Using what again?
AZO. I don't know what that means.
I don't know what AZO is. No. Not sure. Is that a medicine?
Yeah, over the counter.
Yeah, no, preferably not.
Okay. Yeah, because it's medicine over the counter from the pharmacy. Okay. And
there was Y1M here, a question. Well, because it's an acute. It's
yeah.
in the acute phase, so it needs to be higher potency.
And then we have one more question, and we can close with that so that I can show the PowerPoint pictures after that. How long did it take for the eczema to resolve after initial aggravation of the skin?
Well, in the I think the month follow-up, he just had it on his eyelids, so I think it went within a couple of weeks after that. It was all resolved, so quite quickly, really.
Okay.
She says, all cases I've seen of phosphoric, and there is a deep grief. Yeah, I had no information about any grief in his story. Possibly something was there when the eczema happened. It could be, but I don't know, unfortunately.
Okay.
Manfred is saying phosphoric acid is also in skin eruptions suppressed, second degree. Oh, very interesting, Manfred. Yeah, so ailments from suppressed eruptions. Okay.
Okay, Andrew, these are very, very interesting, short, brief cases and very straightforward. Thank you so much for that. And now I'm going to share my screen. I just want to say, so basically, what I would like to say is that for anyone who'd be interested and who does not have Ithulcus Compass, they can get in touch with either me or Andreas Chocarnas. And I would also like to thank you all for attending. We will be having our next webinar in December, on the 8th of December, with Andrew again. So we hope to see you all back here again in December, which will be in about a month and a half time. Until then, Andrew will be presenting a very interesting case in Edinburgh at the conference of the Faculty of Homeopathy. I don't know if any of you will be attending, but just in case you are, he'll be presenting a very interesting case there. So maybe we see you in Edinburgh in November. If not, we'll see each other again here in December. Thank you very much. I don't know whether you want to add anything, Andrew.
No, thank you very much for attending, everyone, and nice to see you here, and stay well. Stay well.
Thank you. Bye-bye to all.
Bye.
Bye.